Hello and welcome to financialexpress.com. I'm Sushmita Panda. India is known as the diabetes capital of the world. The number of diabetes cases have increased alarmingly in the recent years. According to reports, the number of diabetes cases are expected to rise up over 134 million by 2045. The impact of diabetes is numerous, and one of them is eye complication. The most common type of retinopathy is often related to diabetes. On the occasion of World Diabetes Day, today we have with us Dr. Manisha Agarwal of Dr. Shroff Charity Eye Hospital to talk about the prevalence of retinopathy in India. Dr. Agarwal, welcome to financialexpress.com.
Thank you so much.
Okay, ma'am. So, to begin with, would you please elaborate or throw some light on like how diabetes affect the eyes and what is the prevalence of this disorder in India?
So, as you all know that we are celebrating the World Diabetes Day on the 14th of November. And India is known as the diabetes capital of the world. Any diabetic, whether young or an old patient, whether the patient is of type 1 or type 2 diabetes, any patient suffering from diabetes is at the risk of developing diabetic retinopathy. And what do we mean by diabetic retinopathy? We are all aware that diabetes affects the small blood vessels of the body, and it can be in any part. It can be in your limbs, it can be in the heart. Any part of the body can be affected by diabetes, and eyes are no exception. So when the small blood vessels of the eye, especially the retina, which is the back part of the eye, gets affected by diabetes, it is known as diabetic retinopathy. And it can cause a very subtle loss of vision without the patient even realizing. As far as the prevalence of diabetic retinopathy in India is concerned, it is about 16 to 18%. But what is more alarming is that 45% of the patients, when they present for an eye checkup in our clinic, they have already lost vision secondary to diabetes. And that is something which is a major concern for all the eye specialists like me.
So, what are the causes and symptoms of especially diabetic retinopathy?
So, as far as the causes is concerned, the most important cause of diabetic retinopathy is the duration of diabetes. So, many patients think that I've been having a very good control of diabetes, so I will not develop diabetic retinopathy. So, that is a very big misconception. If you are a diabetic and if you have been more than 5 years of type 1 diabetic, you are at a risk of developing diabetic retinopathy. While if you are a type 2 diabetic, the day you are diagnosed with diabetes, you have to get your eyes checked because you may not be even aware that for how many years you have been a diabetic, and all you know that you may be having a very advanced stage of diabetic retinopathy without you even knowing about it. As far as the symptoms of diabetic retinopathy is concerned, it could be something as simple as blurring of your reading vision, which is the most common. You start realizing that you're not able to read the small print of the newspaper or the books that you routinely read. So it could just be a mild blurring of vision. And where the patients go wrong is they walk into an optical shop, they get their eyes checked, and they take a new pair of glasses and they think that they are done for the day. But that is what is, something we need to understand, that in the initial stages of diabetic retinopathy, you have very simple symptoms like blurring of vision, nothing beyond that. It is only when the diabetic retinopathy becomes more advanced, you can have symptoms like floaters. You can have a significant amount of loss of vision, which is not getting corrected by a change of pair of glasses. You can also have, a sudden blackout in front of the vision that could be secondary to the bleeding inside the eye. And last but not the least, you could have a black curtain coming in front of the eye because of the detachment of your retina. So we have to be aware of all these symptoms, and we should not really ignore if we are having any blurring of vision in our eyes.
Dr. Agarwal, there are various types of diabetes. So, does these retinopathies are show different kind of like symptoms in different varieties of diabetes? And as far as India is concerned, according to you, what is the status of diabetic retinopathy in the country?
So, as I just mentioned, that both type 1 and type 2 diabetics, they are at the risk of developing diabetic retinopathy. There is absolutely no difference in the manifestations of the diabetic retinopathy. They very much remain the same in both the type of diabetics. The only concern is that the patients having type 1 diabetics, the progression of the diabetic retinopathy is going to be very fast and in a very aggressive mode. While in type 2 diabetics, you get enough time to get your eyes screened and to get them managed. And it is not usually in such an aggressive and in a fast progressive mode as in type 1 diabetics. As far as the prevalence I mentioned, it's about 16 to 18%. But usually, when we compare our diabetic patients with the diabetics of the Western population, the problem is that here the patient they present very late because the awareness of diabetic retinopathy is very less. So till they don't start losing a significant amount of vision, they do not usually present to eye specialists. The other risk or the other reason for the patients to present late to our clinics is that they have been under the care of diabetologists, they have been under the care of a physician for several years now, but they have never been really advised to undergo an eye checkup. And even if they do undergo an eye checkup, usually it is going to be a half-hearted eye checkup, which is not going to be involving the dilatation of the eyes and a complete retinal examination. Because what we need to realize is that the diabetes is affecting the retina. It is not really affecting anything else. So we have to make sure that the patients have undergone a complete eye examination, including a retinal examination.
Dr. Agarwal, other than diabetic retinopathy, what are the other types of retinopathies that are common in India?
So we have several other kinds of retinopathy. There is a retinopathy secondary to high blood pressure. There can be retinopathy secondary to anemia and so many other causes. But I feel that the diabetic retinopathy at present is the most common because we know that the diabetics are on the rise and so is diabetic retinopathy.
So what are the diagnosis and treatment measures that for these diabetes related eye complications?
So I would like to again re-highlight the very fact that any diabetic patient, please do not wait to start losing your vision. The day you are diagnosed to have diabetes, please undergo a complete eye examination, including a retinal examination. I feel that is of utmost importance. Now, this is going to actually prevent from developing the late advanced stages of diabetic retinopathy because a certain percentage of vision with treatment can be reversed, but a certain percentage is a permanent loss of vision, which cannot be reversed with the best of the treatment. As far as the diagnosis of the diabetic retinopathy is concerned, it's a very simple test where we dilate the pupils of the patient with medicine, and subsequent to that, there is an indirect ophthalmoscopic examination which is done and which is for the complete retinal examination for the diagnosis of diabetic retinopathy. Other than that, we have certain tests such as optical coherence tomography, which is for diagnosing the edema, that is the swelling of the central part of the retina, which is called as the diabetic macular edema. And also we have certain tests like fundus fluorescein angiography, which basically diagnoses the development of new blood vessels in the retina, which happen to develop secondary to the lack of oxygen and blood supply to the retina. As far as the treatment is concerned, the treatment primarily comprises of three things. One is the intravitreal injections, as we call, of various drugs, which are given inside the eye, which helps in the regression of the new blood vessels. The second is the laser photocoagulation, that is the laser therapy, which is done again to regress the new blood vessels. And last but not the least are the complex retinal surgeries, which are done for cases which are presenting with the hemorrhage inside the eye or with retinal detachment.
Dr. Agarwal, would you please elaborate on is it possible that all the diabetic patients are vulnerable towards diabetic retinopathy, and what is the ratio, like how many diabetic patients are more prone towards diabetic retinopathy?
So all diabetic patients are very much at the risk of developing diabetic retinopathy. If they are going to be, and as I mentioned, the duration of the diabetes is the most important risk factor. Other than the duration of diabetes, it is, of course, what kind of a metabolic control you are keeping. So the onset of diabetic retinopathy depends on the duration of the diabetes that you've been having, but the progression, that at how fast a speed the diabetic retinopathy will progress, depends upon what good control of your diabetes, your blood pressure, your cholesterol levels you are keeping. If you're having a good control, the progression is going to happen at a much slower pace. And if you're having a poor control of blood pressure, sugar, cholesterol, then the progression of diabetic retinopathy to advanced stages is going to happen much earlier. Both type 1 and type 2 diabetics are prone to develop, and the prevalence of developing diabetic retinopathy, it is about 16 to 18%, and sometimes a few of the states have also gone up to 20%. The risk of severe loss of vision in the patients having diabetic retinopathy is about 5%.
Dr. Agarwal, for our viewers, would you like to, mention some important steps and preventive measures that all the diabetic patients should take in order to, delay or prevent these retinopathies from happening?
So I would like to just give out one very important message on the occasion of World Diabetes Day, that please, we all request on behalf of Vitreo-Retina Society of India also, that please get your retina checked for diabetic retinopathy every year. And we take so many selfies of ourselves. At least learn to take one selfie of your retina, get one photograph done of your retina, and diagnose or come to know that you're suffering from diabetic retinopathy at a very early stage. As I mentioned, please do not wait for diabetic retinopathy to cause a loss of vision, subsequent to which you are going to be visiting an eye specialist. And with the best of the care and treatment, a certain percentage of vision will be reversible, and a certain percentage of the vision is going to be a permanent loss of vision. So I feel that the most important message from my side would be that please do not live in this misconception that I'm having a good control of diabetes, so I'm not going to develop diabetic retinopathy. In order to lead a dignified, in order to lead an independent life, I'm sure all the viewers will realize that the vision is extremely important. And to have a good vision throughout your life, the Guru mantra is to get your eyes screened involving the retinal examination at least once a year. And subsequent to your base examination, your eye specialist will tell you that how frequently again you have to come back for an eye examination. So please get your eyes checked every year, at least once. And the other thing I would just like to add is that any friends, any of your colleagues, if you know that anybody is a diabetic, please also counsel them that they have to get their eyes checked. We keep waiting. We have heard a lot of patients saying that I have never been told that I have to get my eyes checked. So I would love that all the viewers who are listening this today, they not only confine this knowledge to themselves, but also spread it to their communities, to their friends and colleagues. If anybody is a diabetic, please get your retina checked, please get a timely management done, and enjoy a good vision throughout your life.
Dr. Agarwal, thank you for joining us. It was a very insightful session with you. Thank you so much.
Thank you so much for this opportunity.